I'm Luciano Nard, I'm the Clinical Director at the Reproductive Health Group.
And I'm Caroline Watkins, I'm the Senior Embryologist here as well.
Assessing ovarian reserve and selecting the best population for egg freezing is of paramount importance. Chronological age per se is the main determining factor. However, assessing how the ovaries are in advance of starting controlled ovarian stimulation to collect eggs for freezing is important. We normally recommend that women have a blood test for the ovarian reserve marker AMH, which is a hormone produced by the granulosa cells within the follicles, and also have an ultrasound scan to assess the number of antral follicles, which are follicles that measure between 2 and 6 millimeters, seen within the ovaries at the beginning of each menstrual cycle. The combination of AMH levels and the antral follicle count, in addition to the chronological age, will help us to determine if the female patient is suitable for undergoing the egg freezing program. Patient selection is not just something we can sometimes choose, as egg freezing is also recommended for medical reasons, and that may be in women that have some underlying health issues for which medical cryopreservation of eggs is recommended. Egg collection is a straightforward procedure. It's done in the procedure room, and within our clinic we perform the egg collection under sedation. Takes about 15 to 20 minutes, and we have a consultant anesthetist present in the room, together with a nurse assisting the clinician while collecting the eggs. We use a transvaginal approach, so an ultrasound transvaginal probe is used, and on top of this we will slide a needle holder, and the needle holder is obviously used to guide the needle into the ovaries. Each ovary is visualized under ultrasound scan, and then eggs that are normally one per follicle collected and put into a plastic tube, which is passed on to the embryologist for assessment under the microscope. There is not a single protocol that is good for everyone, and in the fertility field we've moved away from one size fits all. It is important that we take into account the female chronological age, as well as the ovarian reserve marker, both AMH and antral follicle count, in order to determine which protocol is most appropriate to achieve the safest and most effective response to stimulation. Assuming that most women embarking on egg freezing are young, fit, fertile, and have a good ovarian reserve, we would be using a short antagonist protocol, which has been known to assist a satisfactory follicular development, as well as reducing the risk of ovarian autostimulation syndrome. Most women that will be embarking on an egg freezing program are likely to be single, perhaps very career committed, and perhaps not in a position to think about starting a family in the immediate future. So they may be having some questions that are better answered by an independent fertility counselor. They require a significant degree of information, and sometimes digesting that information on their own may also not be good. We always encourage women to talk to family members and friends, but in case they prefer to discuss with a third party, an independent person, we offer support counseling within the clinic.
So as Mr. Nardo said, the follicular fluid comes through to the lab, and we look at this under the microscope, and we find eggs present in that fluid, and we culture it for a time. We then take away the big cloud of cells that are present naturally around the outside of the egg, and again look at the eggs under the microscope and assess them for their maturity. And we're looking for a structure called a polar body to indicate the egg is mature, and those eggs will be selected for vitrification. As I just said, we use vitrification to freeze eggs, and it's a process that involves the use of cryoprotectants. The eggs are exposed to the solutions in a stepwise manner, and it dehydrates the egg and then actually rehydrates them with the cryoprotectant incorporated into the egg. And these eggs are then loaded onto a vitrification device and plunged into liquid nitrogen. This is done in such a way that eggs avoid going through a critical temperature change, which and the old conventional method of slow freezing led to ice crystal formation and led to eggs unfortunately dying as a result of that freezing process. I think from a technical point of view, they probably could stay in storage for a good 100 years, as long as somebody's topping up the nitrogen and keeping them at the right temperature. However, we are governed by the HFEA in this country, and the guidelines state that it doesn't matter who you are, what age you are, you have a statutory right to store for up to 10 years in this country. There is the possibility to extend that storage if you are deemed as prematurely infertile near the 10-year anniversary, and you can extend in potential 10-year blocks, up to 55 years as a very maximum.
I think any woman that has got frozen eggs and decides to use those eggs has to think about the financial, emotional, and physical implications of embarking on a pregnancy first. We don't believe that egg freezing should be seen as an employment benefit or indeed an insurance policy, as in that case some women may think about delaying motherhood to concentrate on other things in their best fertile years. But if the use of the cryopreserved eggs is needed, I think the first thing to bear in mind is whether the woman is healthy at the stage that she wants to use the eggs. Second is why using the frozen eggs if she could perhaps attempt to conceive naturally, obviously provided she's got a partner, she's in a relationship. Three, what would be the consequence of using the frozen eggs? We know that there might be some reasons, or the woman may have had some medical problems for which the use of frozen eggs is the only avenue to have a family in the future. But if not, we would recommend that trying to conceive naturally or trying to use fresh eggs if there is a need to embark on assisted conception treatment will be the preferred option. We also recommend that before using frozen eggs, if that is required, the woman has a full understanding of the fertilization as well as the embryo creation and embryo transfer, so to have realistic expectations about the process and the chances of success. There are no reports in the literature to suggest that the use of frozen eggs increases the pregnancy-related problems, that being both maternal and or fetal issues in pregnancy. However, we know from some egg donation studies where frozen eggs have been used that there is an increased risk in pregnancies, but that is likely to be associated with the use of the donor eggs rather than with the freezing of the eggs. A successful egg freezing program relies on a well-established and consolidated multidisciplinary team. And unlike many other areas of medicine, we know that the provision of fertility services is not just one specialty. We are very fortunate at the Reproductive Health Group, as we can rely on excellent expertise and skills in the lab. We also have a highly committed team of nurses. We have independent counselors, and also some care coordinators that put patients' interests and well-being at heart. So when we look at a successful egg freezing program, we have to make sure that a clinic can offer the clinical, the laboratory, and the nursing aspect of the treatment to ensure that that patient feels supported, understands fully the implications, but also she is satisfied based on the information provided that the eggs will be cryopreserved using the best and most up-to-date technology, and that those eggs, once they needed to be defrosted or thawed, and they will be used as well using some standard laboratory processes. And we know that the success of the treatment itself is not just dependent on the protocol that has been used, employed, recommended, but it's very much on the commitment as well as the ability that eggs have to survive after the thawing process, which is very much dependent on the freezing itself. I think what I'd like to say in conclusion is that anyone thinking about freezing eggs should seek information from the clinic, should rely on a service that has got an established egg freezing program, should have the opportunity to ask questions to the clinical and scientific team, and should also have an understanding that freezing eggs at a later stage in life is not the best option. Eggs should be cryopreserved as early as possible during reproductive life, if those eggs will be used or can be used in the future. And we also need to be aware that at the moment in the UK, the 10 years storage period is something that has to be borne in mind when the decision about freezing eggs is made. As a woman that is going to freeze eggs at the age of 25 has potentially got 10 years to use those eggs, which makes her 35, and maybe still in a career life or work environment and not made the decision about starting a family. So the information, the counseling, the clinical care, and the nursing support that women freezing eggs receive, in my opinion, is central to the successful program. Thank you.
Thank you.